Oh, baloney. The whole thing always gets back to drugs.
Hello, my name is Sandro Graca and I'm a licensed acupuncturist. Thank you everyone for your comments on the previous vlogs. We've been having a really busy time with the acupuncture vlog, which is great because we are loving it and there's way more to come, which is pretty cool. So please keep sending us your comments, your suggestions, ideas for future vlogs because we are loving it. We're getting great feedback from other practitioners, we're getting great feedback from other clinicians, not just acupuncturists. And the most amazing thing is that even the patients in the clinics are passing comments. So to all of you that watch our vlogs and send us comments and share and pass it on, I can only say thank you so much, and please keep doing it. Hit the subscribe button and hit the notification bell because you'll then be the first one to know when there's a new vlog out. So this one is a little bit special for me because over the last couple of weeks I've been trying to put this vlog together and a lot's been happening on the background, and the person who's waiting on the other side of the line was actually then named one of the speakers at the IFS for next year. So he's going to be one of the pre-symposium lecturers at the Integrative Fertility Symposium 2018. You can see the vlog here where Lauren Brown kindly went through the list of speakers that were confirmed, and registration is now open, so you can go and check it out. So this person that is waiting on the other side of the line was not only named one of the lecturers for the pre-symposium nonetheless, but then he was also doing one of the live webinars with Medigogy, and there's the Pro-D Seminars live webinar coming up. So if you're watching this fresh off the press, the webinar is going to be the following weekend. If you're watching this later, don't worry, the webinar is going to be recorded, so you can always access that recording. And as you know from the previous videos, we have a few news going around about Pro-D and Medigogy. So without any further ado, on the other side of the line is a guy who is a fantastic lecturer, a great speaker. He travels around the world. As I said, he's going to be one of the speakers at the IFS, and he's also one of the main people behind the amazing ICCM in Israel. So there's a lot that I want to ask him, so best to go over to split screen and just talk to Assaf Mor. Hi, Asaf.
So,
Thank you so much for your time. It's really kind of you to give us the time. I know it's a different time zone and it's late there, so thank you so much. I've been trying to get you online because there's loads that I want to ask you, and even loads more happening over the last few weeks. I know you've done, I was just saying offline, you've done a Medigogy talk, you have a Pro-D talk coming up soon enough, and you've been just named one of the speakers for the Integrity Fertility Symposium 2018 as well. So
yeah,
just because we're recording this the week before the that talk at Medigogy was also Paediatrics, and I know in advance that the lecture, I don't know how much you can say about the lecture at the IFS, but that will also be on Paediatrics as well. So that's kind of like your field. It's your passion to look after the that particular area of acupuncture and Chinese medicine.
yeah, you described it right. I think pediatrics is my passion. I mean, my clinic combines both pediatrics and adults. I don't do fertility. I mean, if we're going to talk about, like you do, if we're going to talk about Sun Miao, and this is, by the way, what we're going to talk about at the IFS. We're going to talk about Sun Miao's writings. I'm going to have an amazing workshop together with Sabine Wilms. I know it's going to be amazing because we had a short version of it here in Israel in the ICCM, and now we're going to do a longer version. It was so fascinating, so we decided we want to do it again. And we're going to talk about Sabine's translation for Sun Miao's book, and especially on the idea of how to maintain health according to his structure, which is treating women first, and then children, and then treating adults. And so this is what's going to be in the IFS. And as I said, I mean, treating children is my passion, but I never gave up about my passion for treating adults. So I always look at this movement between childhood to adulthood, and how it affects health, and how treating children can create better or healthier future for the patients. So whenever I see an adult, I always look backwards to his childhood and see how things went on. So this is something I deal with a lot, and I see it a lot. And yeah, so this is gonna be the talk on the Medigogy is going to be about that. Sorry, in the ProD is going to be about infection, and we talked about Medigogy about FAPA, which is a heat recurrent episode, and we're going to talk about in the IFS. We're going to talk about Sun Miao's understanding, and then I'm going to talk about in the IFS about IVF babies. So yeah, quite a lot of pediatrics.
Yeah, I remember talking to Lauren about that, and I was just fascinated in wanting to know more. Just as a quick aside, my first experience of the IFS was the year that, and that was a pre-symposium talk, the year that Deborah Betts did the pre-symposium with Sabine Wilms as well. So that was Siobhan and I walking into the IFS pre-symposium, and that was the first talk, the first day for us, and we were just fascinated how it was so good to have Sabine there with her knowledge and, being able to translate from, the Asian book. It was amazing. So I can only wait for your own talk as well. And the fact that it's going live throughout the world, it's not worrying you one bit then, no?
It is. It is. But at least in the IFS, I'm going to have an audience. Talking, talking ProD and Medigogy in front of a computer, it's always something I always miss the audience. I love talking, I love teaching, but talking in front of my own presentation, I don't see how the audience feel. But I'm gonna go over it, and it's gonna be fun anyway.
And that's the aspect of the having stuff like this online, which is part of why I love to having people like you giving their time to come on, and just to show. I get comments from patients in the clinics that actually watch the videos that are the interviews with the experts like this one, which I thought that probably they wouldn't, because it's like I probably won't even know what they're talking about. But I have comments. I have people coming into the clinic with comments, and sometimes they even post it on social media as well. And I'm surprised that the general public is actually watching this, so that's pretty good, which ties in nicely with what I wanted to say to you, which is the fact that a lecture like that, where you will be talking about pediatrics and even focusing more on IVF babies, that going live and being available to anyone else in the world, that's amazing. Because one of the main things that you would think, and as a parent I would say the same thing, you think about acupuncture for an adult and you think about acupuncture for a child. Is the child going to be okay with the treatment? How does it really work? Can you, with your expertise and your knowledge, just if parents are watching this, what would you say to them?
Well, I'll tell you what I always tell parents when they first call me, when they ask the question, how can I explain to the child, or how can I even try to convince them? So I tell them, don't convince them. The only reason where children are afraid in the clinic is because their parents are afraid. And if they come to the clinic and to treatment and they're already afraid, it's only because someone told them before, don't be afraid. They don't know it. I mean, when they go to a totally new, different experience, and they don't know anything about it, I mean, they'll be a little bit curious, maybe a little bit, cautious, but they won't be afraid of it. And especially if they have their parents with them. So there's no reason to be afraid unless the parents are afraid. So I'm always telling the parents, the problem is actually with you guys. You should come cool and stay calm and let me do my job. And don't tell anything. Just tell them that you're going to the doctor, going to a Chinese medical practitioner, whatever you need to tell them. It varies according to the country. But don't try to explain. Whenever you'll say it's not gonna hurt, they'll start fearing it's gonna hurt, and don't tell anything. And the minute they go into the clinic and they meet me and we talk, and I give them sometimes in order to break the ice, I have some stuff in my drawers that I put on the table, and sometimes I have presents for them. And then if I see that they're talking to me, but every time their eyes are looking to the needle boxes. I ask them, do you want to know what this is? They're like, no. So just give me a second. I'll show it to you. Trust me. I know that you don't know me, but I just ask for 1 second, and then I just put a needle on, and that's it. And then it finishes, and then they're cool, and we can continue talking. And they are really waiting to have this experience again. And so it's all about how you show the needles and everything. I mean, it's quite a cool experience, but you need someone who's experienced with the pediatrics in order to do that. Other than that, I have other techniques for children who have needle phobia. I mean, these are the children that had too many treatments before, either with acupuncture or other treatments in the hospital. I mean, too many injections or blood tests and whatever. So I use other techniques. This is why I'm doing Shonishin, I'm doing Moxa, and I do herbs, and I of course, the pediatric Tuina or a little bit of Shiatsu. A pediatrician needs to have all these tools with him. And one amazing tool that I've been working with in the last 4 or 5 years is actually the Acu stickers, the Paediatrics Acu stickers. I found them very safe and very easy to use with children. So children like stickers. And then I just take the stickers. They are full with color. You know, they have all these colors. Unfortunately, the pink is the longest one, which is the most painful. So they always want the pink. And I was like, no, try the yellow one. And I'm playing with the stickers. And then I put a sticker on. They're like, that's it. Yeah, and there's another sticker. And if the child is too stressed and crying, I always play with him and put other stickers, because I have stickers in my drawer, and I can put in Fireman Sam stickers, and then a star sticker, and then all of a sudden I'm putting a regular an acupressure sticker on him, and they're like, oh, that's it. Okay, that's cool. And what usually happens is that like in 3 or 4 sessions, the children start to call me Assaf stickers. I mean, in Hebrew, let's go to Assaf stickers. It's not the doctor. It's let's go to Assaf stickers. And they come into the room, hi, put their hands on, and like putting the stickers, because pediatric treatment is so short. This is one of the things you have to learn when you treat children. The treatment is very short, and putting the stickers on, and then they go to the drawer, take their present, and that's it. The treatment is off, and then the parents like, okay, what happened here? Is that enough? I'm like, what do you want? What else do you want? I mean, do you think that'll be enough? I mean, then I ask him, do you really want me to hurt your child? Do you really want me to cause pain to your child? Then you'll feel it's okay for you. The treatment is fine, but it's fun. It's dealing with children or treating children. It's always a relationship between me, the child, and the parent, and you always have to play with it. And it's a fun thing, and it's a very safe. I mean, all works and researchers show that it's a safe method, which is good. It's a good thing. It helped me go and start working in the hospital, because I showed them the research that showing it's safe. I can't do too much harm here, so just let me try. And then they see it's effective. And when they see that it's effective, they love it. And it's a cool way to integrate into the system, because pediatricians are usually they don't have enough methods of treatment. I mean, and the parents are very eager to get a treatment, and the parents hate when they say, "Oh, it's only viral." Well, it's only viral. What can I do? So then, when you give them another option, okay, you can go and do acupuncture. When the doctor says it, and they will say it because you give them another option for treatment, it's amazing.
I think it's fascinating. It's one of the things that I always said in the clinic, that although I didn't go in that field, but in our clinics, we do see like a variety of people. And obviously, as you were saying, because of our work with the fertility, it's quite common to then, at the end of, we got the treatment, we then end up seeing them throughout pregnancy. And a lot of the times we get to see those babies coming back, and then children, and then they get older, and you realize that you've been in clinic for too long, because now the ones you knew as babies are now going to school, and you're like, no, hang on a minute, I remember you as a baby. But I always thought it was
or before, in your case, before even.
No disrespect to any treating any adult, but personally, I always felt that it's so rewarding to treat children in the clinic. And it's funny the way you started answering the question, because only last weekend in the clinic I said that to a mum, which was, don't tell them anything, because just think about it. For an adult, when you say to another adult, don't worry, even if there's nothing to worry about, you're going to go, don't worry about what?
Don't worry about it. Exactly.
So sometimes it's best just to say nothing. And it's really important what you were saying, that relationship between the practitioner and the child as well. It's really, really cool. And that's part of the reason why I wanted to talk to you. Now, inspired by a question actually from one of the patients in one of the clinics that got to see the video, one of the videos with Gil Barzilai, and Gil was talking about the way that he's working with the hospital and the way that things work there in Israel. Can you talk about that a little bit? Because you hinted there about working in the hospital. That's something that you wouldn't see this side of the world, but how did that come about? Do you have a private clinic? Do you work only in the hospital, or do you work only in the clinic? How does that work there in Israel? How do you all work together?
Well, most of us in Israel do both private and public practice. Private, we all hold our own clinics. I'm lucky to work in a clinic with great practitioners like Dr. Yair Maimon and Dr. Eli, and the Gil's work in the clinic, and Elad Yitzchakov. We are a big clinic. We have around 22 practitioners in the clinic, and it's the best thing about it is that you're not alone in the room. I mean, I work, I live, I meet the patient, and then you go out and you meet other practitioners and you discuss and you talk. I talk a lot, and we have a lot of integration and a lot of communication between us, which is amazing. Other than that, Chinese medicine is quite integrated in the health system in Israel. In Israel, we have 4 national health providers, health insurance companies who provide all the treatments, and all 4 have Chinese medicine divisions or special clinics for Chinese medicine. And other than this, in all the hospitals, we have Chinese medicine divisions. Some of them are wider. We have them in many divisions in the hospital. Some having them as just a local clinic within the hospital, but all hospitals have it. So a patient can get a treatment within the health system, which is not private, which is subsidized, which is amazing. This is a dream come true. I think it all. I think the reason for that is that Israelis in general open-minded. I don't know how we look in the press with all the politics, but the Israeli mind is that you always need to try new things. I mean, we're a small country. We had a lot of our history made us feel that we need to strive in order to success. And so whenever there's something new, this is one of the reasons why I have so much. It's called the startup nation, because people are always thinking how we can do something new about something new. And my story, which can explain how it works in other places. I mean, I'm working in the clinic with a doctor who is he's a surgeon, pediatric surgeon, and he's a homeopath, Dr. Daniel Chanel. And I came up with an idea. I told him, listen, I read an article about post and post-operative treatment in acupuncture and how it shortens the hospitalization time, and how it reduces the amount of drugs in the hospital, and how it makes the surgeries or the surgeries shorter and sometimes with less pain. He said, yeah, really? I said, yeah. I showed him. He said, okay, so come and try. We'll figure out a way to find a position for you. Let's try in the division. So I just went on and we talked with the manager of the division. Said, okay, if you can prove that you can bring something new to us, let's do it. And so it's the open mind of let's try something new. If it works, it's fine. If not, don't bother me. And we started doing this service. And actually, it's having a funny story. I mean, I used to give the children actually, this is the time when I started working with stickers. No, it was after I started working with stickers. But I, I, I was trying to give the children acupuncture before they go to the surgery. But unfortunately, you never know when they go to the surgery. Sometimes I used to give them the acupuncture, and that someone came to take the bed to the surgery room. So I came up with the idea of putting the stickers on, and that's it. And I worked in the division, and they have the surgery rooms, and all the children, they went out of the division, got the stickers before the surgery. And I saw, and we saw in the division, that everything went on better, and the children liked it, and the nurses liked it, and the doctors liked it, and we saw all the effects, and it was great. But I never knew how the doctors in the surgery room see it, and how they what do they think about it.
Yeah.
And the funny story is that one day in the hospital, I had a kidney stone attack. So I went immediately, while I was working in the hospital, so I went immediately to the surgery room. And when I went on bed before the surgery, the doctor came and asked, do you have anything on you? I mean, any jewelry on you? You know, you're not allowed to have jewelry on you, metals on you. No, I don't have metals on me. I only have these stickers on me. She said, yeah, you know what? It's an amazing thing. There's a Chinese guy here in the hospital that puts stickers to kids. And it was amazing. All the kids come to the surgery room. So cool. And it helps them recover, and we don't use, they don't throw up later on. I said, hi, I'm the Chinese guy. I said, but you're not Chinese. I said, I know, this is one of the problems. Right? We don't have a name for our profession.
Yeah.
And so I'm a Chinese doctor or whatever. I mean, they said, okay, that's amazing. And yeah, we're planning to do research on it, and we're probably going to do it soon. It's a fun thing.
That's so cool. Yeah. How many times did we hear this about the I do Chinese medicine, but you're not Chinese? No, you know.
Yeah.
That,
But, it was, as I was born in Kenya, and as a child, my friends in school used to wonder how come I was born in Kenya and I don't have black skin, and it's quite the same. I'm a Chinese doctor, but you're not Chinese.
I remember once saying that I was in Beijing University of Chinese Medicine, and saying that I'm a Portuguese guy living in Ireland doing Chinese medicine. You know, what could go wrong? You know.
Yeah.
So yeah,
Exactly.
just reminding me of that. You know, you do Chinese medicine, but you're not Chinese. Yeah, well, you know, surprise.
Exactly.
Yeah. And you see, now,
but we all slowly grew a beard, a Chinese beard. That's how it goes. I mean, it looks now that it's going to be too long. I need to cut it.
Is that it helps you thinking about things? You know, you can then just stay there for a while and think about it. I think
it's actually to show that you have a strong jing. That's why.
Oh, right. Okay.
That's
Yeah.
why men.
Okay. Yeah. Well, Lauren says that he grew the beard because he wanted to vlog, and so you'll see on one of the vlogs soon. You'll see that when he's really up there with the vlogging, he just might go back to the clean shave. So we'll see how that goes. You know, maybe for charity. We never know. But
we never know.
Just going back to what you were saying about the work together, and that was really inspired by actually, people can see it. It's on one of the comments from on Gil's video. That was one of the patients from the clinic, like being really fascinated about the way that things are working there, and that's why it's so important that people like you and people like Gil, that he was over in Poland just recently, and just go around not just Europe but go around the world and say, look, this is what we do, this is how we do it. Because sometimes it's all about where do you start. But just as you were saying, where did you start? You just had some research, you got to talk to the doctor in the hospital and just go, you know, let's try it, let's see how it goes, and just take it from there. And that is amazing. And it's great that you're doing the work that you're doing. So that's and you're going international, which is even better, because you're spreading the word.
I think for many years I was really trying to avoid dealing with research. I had all these excuses why it's wrong and it's not working in Chinese medicine, and etc. and etc. But the minute I had to to deal with it because I was asked to show a research when I went to the hospital. And the minute I had to deal with it and I learned how to deal with it, I saw that it's not that frightening. And it's something that you can deal with it and you can learn how to do it. And I'm very glad that Gil is teaching it because it's super important in order to integrate correctly. I mean, this is the way to reduce the fear from on the side of the medical system. And it's, I mean, although we don't like it, it's our ticket. So if you want to use this, if you want to use the ticket, you need to learn how to read research and how to make research. And I'm really optimistic about the integration of Chinese medicine in the health system because, you know, I read in one of the, I can't remember where in the internet, is when they tried to describe acupuncture, they said that acupuncture is now, in some places, acupuncture is described as part of neurology. And at the beginning it sounds weird. Then I said, yeah, you know what? It could be, I mean, yeah, I mean, we put needles on nerves and so we stimulate nerves. So you can call it a little bit of neurology. And if it's going to be another ticket for us to go into the system, and it's a great way to do it. And in the end of the day, it will make our treatments better and will give better treatments to our patient. And I think this is the most important thing.
Yeah, I always see it both ways. I know there's a lot of voices going on about we shouldn't be talking about research because we're only pleasing kind of like the Western medical side of things. But I always see it both ways. I always see it as you can look at it that way, but you can also look at we're trying to put it into a language that our patients and the general public can actually understand it. Because genuinely, it was Charlie Buck was saying this recently that, you know, if you look at the names of bones and nerves and muscles, a lot of those are in Latin. The only reason why we know them is because we're used to them and they've been around for a long, long time. And if you look at some of the Chinese medicine terminology, yeah, not everyone is familiar with it, but if you keep talking about it and you make it more, you know, if it needs to be translated into a different language or just explain it in a way that the public can understand it, that's fine. You don't need to see it as we're just doing it towards the Western medicine side of things. I always see it as everything that I put out is more towards the public and more towards education than necessarily having to be to talk to you know, someone who works in the clinic with me.
Yeah, for sure. I had a talk once together with the endocrinologist. Yeah. And we were talking about adolescents and about teenagers development. And, you know, at the end of the talk, I went to him and I said, he was talking about hormonal cycles. And at the end of the talk, I went to him and I showed him I had an aging with me. So listen, this is a book from 1,000 years ago. It talks about the things you were talking now in other languages. You say, yeah, you Chinese, you always talk about fire and water and wood, and I don't get it, and I don't like it. I said, this is only, as you said, the terminology. When we say wood, we mean this. When we say fire, we mean this. When we're talking about the eruption of kidney, we talk about the eruption of hormones and the adrenal gland and whatever you're talking about. So this is exactly what you're talking in different languages. So, and then he was really curious and started to listen more about it. And what you're doing is amazing. We need to bring this knowledge to the public. And by the way, it's something, one of the things I'm going to talk about in the Pro-D workshop later in the end of the week is that one of the most important things when treating children, especially with ear infection, is to educate parents.
Yeah.
And to explain what you're doing and what's going on. You know, I had a patient the other day saying, well, the doctor said we have fluids in the ears. There's a problem in the ear. I said, there's a huge problem in the ear. I said, what's the problem? He said, there's the malfunction of the ear. I said, what's the problem? He said, he wrote here, there's fluids in the ears. I said, yeah, of course he has fluids in the ear. He had ear infection 2 weeks ago. 90% of the children will have fluids after the ear infection. 50 will have a month later. 30% will have it 3 months later. That's it. This is how it goes. He didn't say anything, but no one explained anything to the parent. And so the parent was was sure that hell is going to go loose and the treatment is not working. And this is part of the thing. And actually, and the Pediatric Association, American Pediatric Association, is saying the same. You need to explain to parents, and this can reduce the amount of drugs and medicines if you give good explanation. And yeah.
Absolutely. It's always better together, and instead of trying to fight one another. And actually, as you're saying, involving, in your case, involving the parents as well, and having everyone understanding what's going on at the same time, it's going to be so much more for the practitioner, but actually support for, in that case, the child recovering as well, because the parents will know what is happening, why it's happening, and what is the process that is involved in it. So I think it's phenomenal.
Yeah.
Oh, baloney. The whole thing always gets back to drugs.